This video is going to look at another psychological therapy for schizophrenia called family. Family therapy takes place with the whole family rather than just the individual schizophrenic patient. And it's based on the idea that some therapists see families as the cause of schizophrenia. If you think back to the psychological explanations, we looked at double blind, we looked at the schizophrenogenic mother. So some theorists do see the family as the main cause of schizophrenia, and that's where family therapy actually originates from. And what it does, it aims to improve the communication and interaction between members of the family, with an aim to reduce any stress in the family, reduce the expressed emotion that could contribute to a schizophrenic individual relapsing back into hospital. And that's the whole point, okay? We're trying to reduce those expressed emotions, that volatile and hostile environment in the home, to help reduce the symptoms of schizophrenia. So family therapy aims to reduce and use a range of strategies to try and improve family functioning. I'm going to give you quite a few of these. You won't have to make them all in exam. Try and remember the best 3 that you possibly can maybe to get into an exam. As long as you can expand on them, that should be enough. So the first thing they'll do is try and do something called psychoeducation, where they help families understand the illness, understand how to deal with the illness that little bit better. They try and educate them about the psychology, so psychoeducation, of schizophrenia. They try and reduce the stress of caring for a patient, so giving families little strategies, little tips on how to help care for their schizophrenic family member. They try and reduce any anger and guilt in the family. A lot of people, when especially talking about expressed emotions, will feel anger, will feel very hostile towards that schizophrenic individual. And this therapy tries to reduce all that anger, try and get to the root of it, to help them understand that having those high levels of anger won't benefit the individual. It's about helping family members achieve a balance between caring for their schizophrenic family member and also maintaining their own lives, because getting that balance can be really difficult. A lot of families will spend the vast majority of their time looking after the schizophrenic individual, whereas they need to try and get a balance between that and their own life. Otherwise, it's only going to increase things like anger, hostility, and stress within the family. It's about helping the family try and anticipate any problems. When can they trying to identify when someone's starting to show maybe their hallucinations, their delusions, and increasing the severity of their symptoms. It's about giving the families the strategies and the knowledge to anticipate any problems before they occur. And overall, it's about improving the relationships within the whole family, within the household. And it's getting those families to start listening and discussing with the schizophrenic patient, rather than just talking at them and telling them what to do. About listening and discussing any issues that they may have. So like I said, these are a range of different things and a range of different strategies that family therapy will give to the family. You won't have to remember them all, just try and remember a few of them in good detail. So family therapy is often used in conjunction with drug therapy. And it's all based on that principle that schizophrenics in high EE families, so high expressed emotion families, have a higher chance of relapse and ending back in a psychiatric ward and hospital. But this whole therapy aims to increase the family's tolerance and reduce any negative attitudes that they're going to have towards that schizophrenic family member. So now we're going to look at the AO3 and evaluation points for family therapy. Again, we use this general therapy issue. We know that you need self-awareness, you need a willingness to engage in therapy. Okay, those people who have the positive symptoms of hallucinations, of delusions, aren't going to be aware enough to engage in family therapy in the first place. Those that have negative symptoms such as avolition aren't going to have the motivation and are going to be very reluctant to actually engage with it. So that's a major limitation of this therapy. Again, we know it takes a long time. Compared to drugs, which are very short and quick and effective, therapy can take long periods of time. Again, it's going to be more expensive than drugs. You're going to have to bring in a therapist. You're going to have to spend long periods of time with that therapist to help reduce those EE feelings in the family and in the household. But there are no side effects. Drugs, remember, vomiting, dizziness, etc. You don't get these side effects when we're talking about therapies. There are studies to support the use of family therapy for treating schizophrenia. Faro conducted a meta-analysis of 53 different studies where he looked at family therapy versus drug therapy, and they looked at a range of different responses. For mental state, they found mixed results for family therapy. For some people, it helped them. For other people, it didn't help their schizophrenia symptoms. For compliance with medication, family therapy helped patients continue to take their medication and increase their compliance with medication. In regard to general functioning during the day, it had no effect on them living independently at all. But it did reduce the rate of relapse. So the amount of people who went home and then ended up back in hospital was reduced if they were involved in family therapy. So it appears from this meta-analysis that although it did improve the quality of the life of parents and families, the biggest benefit seems to come from increasing their medication compliance. If you're involved in family therapy, you're more likely to continue taking your drugs. You're more likely to keep taking those antipsychotics. And that's probably why we see an improvement in the quality of life for patients, for family, and also a reduction in relapse rates. So perhaps family therapy is just important to help people continue taking their medication. However, Farah did find that there is large methodological issues with many of these studies. For example, although we have 53 studies and they all claimed to be randomly allocated, a large number of these studies were actually done and conducted in China. And there have been claims that they weren't randomly allocated at all in order to show an improvement in the results for family therapy. Also, Farrow pointed out that there is a lack of blinding in these studies. So therefore, when there's no blinding in a study, you get the possibility of observer bias, because the psychologists were aware of those who were involved in family therapy, those who were involved just in drug therapy, those that were a control group. So 10 of the studies out of the 53 weren't blinded. 16 of them didn't say whether they were blinded or not. So this is going to really reduce the validity of the studies, because if the observer knows who's been in family therapy, that's going to influence their results. So with the impact on family members, there is an additional advantage to this therapy over all other therapies we've looked at. And this is that it has a positive impact on other members of the schizophrenic family. Lobban reviewed 50 studies and found that 60% of families and family members reported a positive impact on their lives. So things like coping with the schizophrenic individual, dealing with the problems when they rose, the quality of their relationship with that particular individual, and reducing high EE inside their family. So there is an improvement for the whole family rather than just the schizophrenic patient. But again, even when Lobban reviewed these studies, methodological issues were rife in them. So although we've got research support, there are always issues with it. Again, we come back to this issue that treatment does not cure schizophrenia. Okay, it helps people live with the stress, and it helps their family deal with the stress more, helps the schizophrenic patient be involved in a family where there's less negative emotions, which is really, really well worth doing. But this shouldn't be confused with curing schizophrenia. Okay, and its failure to cure schizophrenia is a major limitation of the psychological therapy.